Let's talk about when liposuction in the addition to breast reduction makes sense. So when you do a breast reduction, you're doing a breast reduction. You're just reducing the size of the breast. But sometimes in the process of doing that, certain things become more noticeable. In particular, little collections of fat right here in the axilla, the sides of your chest right here, we call that the bra roll, and sometimes even your stomach. So it's important when you're considering a breast reduction to look at these areas and to consider whether these areas are a little out of proportion with the rest of your body, and you may consider bringing them down with liposuction at the same time. Now, some people will say that every patient should have liposuction done at the time of breast reduction, but I don't really agree with that. The way that I do a breast reduction, I narrow the footprint of the breast a little bit. It pulls things in, and unless you have a lot of extra tissue on the side, I don't find that most patients really need it. I have had patients that are a little more full in their stomachs, but they have larger breasts that hide it, and they're concerned that they're going to notice it more, and you do usually notice it more because when your breasts are no longer blocking that, it's more in your field of view, so it may be something to consider. Now, I also have patients that just don't want to do anything at the time of the breast reduction. They'd much rather just do the reduction, wait and see if any of these areas bother them, and if it does, they can do something at a later date. So it really is whatever you want to do as a patient. So it's important that you talk about these areas with your surgeon and determine whether they're a little out of proportion or if your surgeon thinks they're likely to bother you more after breast reduction, and then decide whether it makes sense to manage it at the time of the reduction or wait till later.